Sales. Yep. Good morning, everyone from Florida Blue and USF. So I'm here to present our independent study on detecting mental illnesses among social media users in Florida using NLP. So I'm here. This will be a presentation of about 20 slides where I'll give a walkthrough of what we have accomplished so far and what the results say, and based on those results, what we can do in order to improve the state of public health in Florida, as well as some recommendations for Florida Blue. So this is a slight overview of what we did so far. So first things first, we did a literature review. We tried to understand the problem domain, the kind of previous work which was done by researchers in this space, and what kind of tools and technologies they used for their analysis. Post having a fair idea of the problem, we designed a methodology for retrieval of data from Twitter. We looked at population density weightage and came up with clusters in Florida where we can pull data for the maximum number of users. And our Twitter data, which is our test dataset, has a volume of 408,000 tweets. When it comes to training our machine learning models, we have used the Reddit mental health data set from the Journal of Medical Internet Research. This contains Reddit posts of about 344,000 records, which pertain to mental health channels on subreddits on the Reddit social platform. Post running the machine learning models, we use the best performing model for the prediction and classification of those tweets. And then we have built some analysis and recommendations. So here are some of the papers we reference and their links. So the methodology for data retrieval is based on population density. We know that as per the US Census Bureau and what research says, around 70% of Florida's population lives in three clusters. One is the Tampa-Orlando belt, the second is the Miami belt, and the third is the Jacksonville area. So we came up with 4 clusters in Florida where we can ensure that there is minimal overlap, and at the same time we cover as many cities as possible. So the way it works is, when we are retrieving the data, we are feeding the geolocation code and the radius from that spot. So we have 4 clusters for which we are pulling the data from, and the radius for Tampa, Miami, and the Panhandle is 100 miles, and the radius for Jacksonville is 65 miles. The total data sample volumes are shown in this picture. As you can see, the data for the Panhandle and Jacksonville cluster are comparatively low than the Tampa and Miami belt. Overall, through geolocation, we were able to pull 213,000 tweets, and through the city name search, we were able to pull 194,000, a total of 408,000. This is a sample of what the Twitter data looks like. So you have the row number, you have the URL, you have the date, time stamp, and the content of the tweet that was posted, and the username, and the keyword based on which we searched, because these tweets were retrieved based on these keywords that you see here, which again come from the literature review and what researchers say are the most contributing factors in order to gather this data from the social media platform. Columns G to M have been derived from the date stamp for some kind of a descriptive analysis and to see how the data is distributed across those different features, which we'll see in the visualizations. So as you can see, for the tweet distribution of 408,000 tweets, you can see that across months, it is mostly consistent, except for April. There are a lot of tweets in terms of volume in the month of April. When you look at it year-wise, one thing that needs to be noted is we have not used an year filter when we are retrieving data at any point. So every single time we are retrieving records, 10K records is what is fed as the default value, except for stress and anxiety because those are the most common. So when we go ahead and say get me 10,000 records for with the keyword PTSD for the Tampa Orlando belt, we have got only 5,963 tweets. And these work in successive fashion. First, it tries to get data for 2021. If the 10,000 limit is not yet met, it goes to 2020, goes to 2019, and so on. So as you can see, the data volumes from 2018 to 2022 are pretty high, whereas the others are comparatively low. And when you look at the tweet distribution based on the day of the week when it was tweeted, um, it's a little surprising, but the weekend volume is comparatively lower compared to the other days of the week, even when you view it at a single level. Now, this is something interesting. When you look at the tweets which were posted by the hour of the day, you can see that the volume of tweets is extremely high until about 5 a.m., 4 to 5 a.m., and only after that it drops down. Normally, we would have expected that the curve kind of goes down around, say, 11 p.m. or so, and then comes back up around 8 a.m. But turns out that most people who suffer from some of these mental illnesses are kind of staying up late, at least until 4 a.m. or 5 a.m. This could be normal, but we can't really say with authenticity that these are perfect conditions or that something's going on, but definitely something to look at from a healthcare point of view. If folks at Florida Blue are aware of what kind of conditions affect them, I'm sure they would know better than as to how it affects some kind of sleeping patterns maybe. Like I said, we used the Reddit mental health data, and this is the reference. So we used so when you look at the sample, this is how it looks like. You have a subreddit on the left, which is the channel of the Reddit where the content was posted, and then you have the post. So when you look at this particular reference from Reddit, these are the subreddit channels which relate to mental health issues. So we have used the data from these subreddits in order to form our final text corpus. And the distribution of the posts based on the channel is shown here. As you can see, anxiety, depression, mental health, and suicide watch have a relatively high number of posts, but the others do not. So coming to the process and machine learning models, just to kind of summarize what I said, we took Reddit's data, we formed a text corpus, and then we cleaned this data, converted to lowercase, removed punctuation, special characters. We used some standard NLP techniques such as tokenization, lemmatization, removal of stop words, and this processed tweets were used to train the model using a TF-IDF vectorizer and an n-grams approach. So essentially what a TF-IDF vectorizer does is it converts a text into a certain numeric format, and the model learns these text keywords in the form of weights which it gets from the converted numeric output. So we trained a naive-based model and a logistic regression model, and the logistic regression model performed better. We had a 74% accuracy. So we used that to, we used that for classification of our Twitter dataset. Tweets were again cleaned and processed using the same approach using NLP, and then the model was run on it. When you look at the overall prediction, we see that anxiety and depression are the most common, purely in terms of overall percentages, but we need to view this at a more granular level. So we'll get to that in the next 3 slides. When you break it down by region, you can see that although depression and anxiety are highest, you can also see that suicide thoughts in these posts are pretty high, followed by PTSD and then generic mental health issues. Now, when we view the percentage distribution of posts of the mental illness type by region, you can see that similar to the last slide, PTSD issues are pretty high in Tampa and Miami, whereas it's relatively low in Jacksonville and the Panhandle. But then again, the suicide watch is pretty high for Jacksonville and the Panhandle compared to Tampa and Miami. Now, one of the trade-offs that we had here is our data set is not balanced. We have a lot of records for Miami and Tampa, whereas for the other two cities we do not. So we kind of need to normalize these numbers to percentages. So here in the first half of the tables, you have the prediction of the tweets in terms of numbers, and in the below half, you have the same percentages calculated based on how many tweets were classified into that category divided by the total number of tweets. So here are some of our interpretations. You can see that depression and anxiety is common in all regions. And then Jacksonville and Panhandle have the highest suicide prediction. PTSD has the highest presence in Miami and Tampa. The highest schizophrenia percentage was observed for the Jacksonville cluster over the others. And Panhandle cluster has the highest health anxiety, maybe due to the fact that they do not have good healthcare infrastructure availability at a widespread level. And then Tampa region has the highest mental health and alcoholism concerns. Some recommendations that we have for the state of Florida and Florida Blue are to increase the suicide prevention lines and awareness, mainly in Jacksonville and Panhandle areas, because this should be done in order to facilitate some kind of a channel where folks with suicidal thoughts actually have someone to talk to and maybe kind of go ahead and enroll for some kind of therapy. Another idea that we have as a recommendation is to conduct periodic surveys for mental well-being across different regions in Florida, and then collect this user survey data over a time period and analyze trends, predict mental health patterns, and then recommend specific health insurance plans to support them so that they can get the exact kind of medication or therapy they need. More health insurance options with specific behavioral therapy and group options are needed. Another recommendation would be to maybe have at least a few initial free sample sessions, so that patients can be encouraged to visit and sign up for those sessions. And then another one that we have is to conduct free or reduced cost counseling sessions in the form of support groups, which can help in fighting anxiety. That's all we have, and thank you.